Hello everyone, welcome back to my channel. For this video, I'm going to be talking about what is a arterial blood gas test, aka ABG test, which I'm going to be having one tomorrow. So I thought I'll make these couple of videos talking about procedures and tests that people with muscular dystrophy have to go through. I had a video planned for, like I say, scoliosis, but I can't find the article I was gonna use. So uh, stay tuned for that video. And then I have other video about other tests that people with muscular dystrophy or have to do every so often. So I'm starting with this since I'm getting an arterial blood gas test tomorrow. So I'll explain what is, in the article it says, what is an arterial gas test? An arterial blood gas ABG test measures the amount of oxygen and carbon dioxide in your blood. It also checks the acidity of your blood. This is called acid-base balance or your pH level. The blood sample is taken from an artery, which is a blood vessel that carries oxygen-rich blood from your lungs to your blood. In an ABG test, the blood oxygen measures shows how well your lungs move oxygen from the air into your blood. When you breathe in, the carbon dioxide measurement and shows in how well your lungs remove carbon dioxide from your blood when you breathe out. Carbon dioxide is an acid waste product that your body makes if your blood and tissue become even slightly too acidic or too basic, alkaline. It can seriously affect many of your oxygen and even become life-threatening. Your lungs and your kidney do much of the work to keep your acid-base balance normal. So the acid-base measurement for an ABG test can help diagnose the motor condition that affects your lung, kidneys, as well as many other conditions that may upset your acid-base balance. Other names are blood gas test, arterial blood gases, ABG oxygen saturation test. And so that's a little bit of what is, an ABG test. Then the article said, what is it used for? An ABG test is used to help check your acid base balance, diagnose serious problem with your lungs and breathing. Muscular dystrophy affects your lungs and breathing. So basically, that's what they're trying to check when they do an ABG test on me, lungs and breathing. I know, like, I didn't know they check kidneys when they diagnose kidney disorder, find out what treatment is working for breathing disorder, kidney disease, or other condition that may affect your acid balance. So that's what it said. Then the other part of the article said, "What do I need? Why do I need an arterial blood gas (APG) test?" There are many reasons why you need this test. For example, you may need an ABG test if you have symptoms of a problem with your acid-base balance, such as uncontrolled rapid or deep breathing, which may be a sign that your lungs are trying to adjust acid or base it by changing the amount of oxygen or carbon dioxide in your blood. Nausea and vomiting, or arrhythmia, a problem with the rate or rhythm of the heartbeat, confusing, fatigue, muscle twitching or cramps, or being treated for lung disease can affect your risk, such as asthma, chronic obstructive pulmonary disease, citric fibrous, my myasthenia graves, I think. For me, it's because I have, like I said, muscular dystrophy. The lungs are affected, like every muscle in your body. Every part of your body has a muscle. And the lung muscle gets weaker over time with muscular dystrophy. So they have to check that stuff every. I get this test every so often. Other things it says have symptoms after you have had carbon monoxide poisoning on it. halation in injury breathing in smoke, hot air, and or harmful chemicals, a recent head or neck injury that could affect your breathing, a recent oxygen therapy in the hospital. Then it says what happens during a blood oxygen level test. Most blood tests take a sample from a vein. For this test, a health provider will take a sample of blood from an artery. That's because blood from an artery has higher oxygen level than blood from a vein. If you don't know where the artery is, the artery is where where you take someone's pulse. You grab somebody's hand if they're unconscious, and take their pulse. That's where they put the needle and stuff, because that, like it's saying, that's where the higher oxygen level that than blood from a vein. It has higher oxygen level than taking any other vein. So I'll keep reading the example. You could take it from an artery on the inside of your wrist, like I was saying, where you take the pulse. But I mean, we take it from any artery in your arm or groin. I did not know that. I knew they can take it from the arm, but I didn't know from any part of the groin. And then it says for a newborn, and some may be taken from the baby's heel or the umbilical cord shortly after birth. I did not know they could do that. If your blood sample is taken from your wrist, the provider will first test your blood circulation. The provider will hold your wrist and apply pressure to the arteries to cut off blood flow to your hand for several seconds. Yes, they do that. I Like it's been a while since they done this tip, but I remember that's what they do, like what it's saying right here. Then the pro will let go of your wrist to check how quickly blood flow returns to your hand. Your blood flow is normal, the pro will collect a blood sample. Yes, that's what they do it. That's how they do it. A blood sample taken from an artery tends to be more uncomfortable than the most more blood tests. Yes, it is uncomfortable. You know how they have those, I call them emoji faces that they have the pain, how much pain you are. I'll say I'm in five. I'm on five pain level, so it is painful. For me, it's a five, which use a vein so the provider may apply some numbing medication to your skin first. I didn't know they can apply this. I mean, I'll have to ask tomorrow. Can they apply that? Because I did not know they give you numbing medication for your skin. This is the provider will insert a needle with a syringe into the artery to run some blood. Yes, that's how they do it. When the syringe for the proper bandage the right puncture site, pressure will apply to that site for at least 5 minutes to stop the bleeding. Like in any, like when they give you a vaccine, they always give you a bandage, and then they always tell you, apply pressure for 5 minutes. Then they say, well, I need to do anything to prepare for the test. If you take blood thinners, including aspirin, ask your health provider whether you should stop taking this then before you test. And tell your provider about all other medication something you take, but don't stop taking any medication unless your provider tells you to. Yes, they give me instructions, and that's what the instructions say. If you are on an oxygen therapy, your oxygen may be turned off for about 24 off for about 20 minutes for the test. This will be done only if you can breathe without oxygen therapy. I don't use any oxygen therapy, so this does not apply for me. But anyone that does apply, it's good to know this information. If you never done this type of test, that's why I decided to make this video. And plus, tomorrow I'm getting this test done, so I thought it was a good idea. Are they risk to the test? Good question right here. There is very little risk to having blood oxygen level test. You may have some bleeding, bruising, or soreness at the spot when the needle was put in. Yes, you kind of do get bleeding, obviously. Bruising sometimes. Soreness, very little. I have gotten bruises. Like my wrist is all purple, like if somebody hit me with something, but obviously it was the needle. My both hands. Last time I did this test, both hands were purple. Like purple, because the bruising basically. But that was it. Like I didn't have no soreness, bleeding obviously. But anyway, it also says very rarely the needle may damage the nerve or the artery. I did not know it could damage a nerve. I mean, luckily for me, I have not been. My nerve have not been damaged, or the artery been damaged either. You may be told to avoid lifting heavy objects for 24 hours after the test. I did not know that, but anyway, I don't. Obviously, I'm in a wheelchair. I don't lift heavy objects, so that's nothing to worry about. But for those that, it's good to have this information for those that are able to lift heavy stuff. What do the results mean? That's the next part of the article. HBG test results involve many body systems that affect each other, and there are many health conditions that can normal results. For these reasons, it's better how you explain what your results mean for your health. Yes, I always ask. I always ask. That's an important thing. After they're done, just ask if they can give you the results at that moment. Some tasks from what I remember, they when they do this test, once they take the blood out, they take it right. They have someone come and get it and take it right to the lab, like quick. After they got the sample, they take it to the lab, and I still do another breathing test. After that, it's just breathing, into a tube and stuff. But that's the least hardest one. So anyway, your ABG test will list many measures, including oxygen saturation, O2 sat. This measures how much oxygen your red blood cells are carrying. Arterial pressure oxygen, PaO2. This measures the pressure of oxygen that dissolves in your blood. It helps show how well oxygen moves from your lungs to your bloodstream. Partial pressure of carbon dioxide, PaCO2. This measures the amount of carbon dioxide in your blood. It also shows how easily carbon dioxide can move out of your body. Then finally, acid-base balance, pH level. This measures the acidity of your blood. Too much acid is called acidosis. My bad for my pronunciation, but too much base, it's called alkalosis. These conditions are symptoms of our problem, the upset of the acid-base balance in your body. And it also says an ABG test alone usually can't provide final diagnosis, so your results are not normal. Your probable likely or more tests to make general abdominal result may mean you have a problem with your lungs or kidney or metabolic disorder. Metabolic disorder affects how your body uses food. For any certain medication may also upset your acid base balance and lead to abdominal ABG test results. And then lastly, it says, is there anything else I need to know about blood oxygen level test? The another type of test called pulse expiratory can check your blood oxygen saturation level. A small clip like device called a pulse is usually attached to your finger. I don't get this type of test, but I feel like it's a good idea to read what it says. The device tells you the percentage of red blood cells that are full of oxygen. Pulse oximetry may be useful for blood oxygen level, and levels are the only concern. Ask your provider if this test is right for you. So I hope you guys learned something about what is an ABG test, and wish me luck tomorrow. Hopefully, I only need one poke, not like thousands of pokes like last time I did it. It's because my blood doesn't flow during the winter. I'm gonna talk about that as well. Why do I hate winter and I prefer to summertime as someone living with muscular dystrophy? I feel like that'd be a good video because the weather does play a factor when you have muscular dystrophy. So stay tuned for that video. But like I said, hopefully everything goes well tomorrow and stuff. But I thought it was a good idea, to talk about this. If there's individuals with muscular dystrophy who have never gotten this test, thought we maybe give you guys, tell you a little bit about how this test works. Or if you don't have muscular dystrophy and you're gonna have an ABG test, you know, just give you a little bit of information. What is an ABG test? What they do, and stuff like that. But I hope you guys like this video and learn a few things. And like I said, that's it for this video. Thank you for watching. Don't forget to like, comment, subscribe, and hit that notification button. Until next time.
I can feel the blood creeping up from the heathens. Got will, got fight, got pride.